Hello everybody, I'm Dr. Joe. Today what I'm going to be going through is instrument assisted Graston technique on a lat. I think it's important, especially with overhead athletes, any throwers. I work with a ton of shoulders. More often than not, I see that the lat is very tight, which adds some restriction in the posterior cuff region. We can use a various amount of methods to get rid of this tightness, from dry needling to soft tissue mobilization to exercise in general. You can also use your hands. I like using the instrument when we get to this point because it saves my hands and it's able to give a more uniform texture to get some of these trigger points out. First, we're going to lubricate the skin so that the instrument slides better. And you want to make sure that the patient is comfortable. Doesn't really matter what position they're in, as far as arm hanging off the table a ton or a little bit. You just want them comfortable, because if they're not comfortable, you're going to fight through muscle. And then from here, we're just going to start working this lat out a little bit. So I change which way I'm going, depending on where I find those adhesions, which for Andrew right here, you can feel them. So working down this way, feels pretty smooth, but once I flip and go back up, you can feel them getting bound up. So that just tells me that's where the adhesions are. You'll see some redness, which comes with being tight. We're not trying to bruise anybody and just try and grind it out. You want to give smooth pressure, and you're lifting and pushing, lifting and pushing, lifting and pushing, about at a 45-degree angle. You can switch the orientation of the instrument. With this area, I like to use the big flat edge. Now, to increase the amount of release that you can get, what I'll have Andrew do is he'll lift his arm up, thumb up. When he gets to the top, I'll have him turn that hand over to thumb to the ground, which is going to increase that pain or that release feeling, and then he'll come back down. And then what they'll do is we'll go back and forth and back down. You can have the patient go at their own pace. But this is one area that I love using instrument assisted to both get a better release for patients, save my hands. So what we can also do after is just finish with some soft tissue mobilization. Any sticking points will release that area. But this is one area that I really like using the tool. We can use it on various other body regions. I use it mostly right now because of my caseload on shoulders, but you can use it on any other muscle group. Thanks for watching.